Doc Talk with Dr. Paul Conley is a production of the Signer Foundation, which is solely responsible for the content. This is Doc Talk with Dr. Paul Conley, brought to you by Plateau Medical Center.
Hello, I'm Dr. Paul Conley, and thank you for tuning in to another episode of Doc Talk. So we're going to actually kind of call this COVID Vaccination Part 2. A few weeks ago we had a show where we talked about the introduction of COVID vaccination. At that time, Pfizer received the emergency use authorization. Since that program, Moderna now also has achieved that same emergency use authorization. So since that time, we've been rolling out the vaccine. I have Dr. Anita Stewart on the program again tonight, who is our COVID expert, who's going to kind of walk us through some things, not only with the vaccine, but also with kind of where we are now. So Dr. Stewart, again, thanks for coming on the program.
Yeah, thank you for having me.
So in saying that, I kind of call this, part 2. So where we were 3 weeks ago, which was before Christmas, before the holidays. I mean, we had Thanksgiving, but it was a pre-Christmas episode. Since Christmas, kind of tell me, where are we now? What's our situation here in the area?
Yeah, unfortunately, our numbers are much worse than they were before Christmas. There were a lot of gatherings, a lot of spread at a time where we already had high incidence, so that has exponentially increased. So we are at a very high incidence in not only in Fayette County, but also across the state and the nation.
So what do you think has, we talk about that increase, what do you think in your mind has contributed to that? What has changed? Is it the weather? Is it the holidays? Tell me a little bit about what's caused this.
Yeah, I think that's it's a combination of those things. People are indoors now, and then you add a high level of viral incidence already stacked upon a holiday. So everyone tended to still get together for Christmas, even if it was in small groups. It only takes one person in a group to spread the virus. So what we saw was that several people were sick or were pre-symptomatic, went to their Christmas gathering with their family, or had a cookie exchange, or did one of the, an event, and then that spread pretty quickly around that group.
So I guess it's kind of like a surge upon a surge. So if you have a family gathering, like say even now, whether it be a birthday party, we got Valentine's, Day around the corner. So when you already have a high level, I guess that increases the risk. If you do have a gathering, an event, that's going to dramatically increase your risk of spread.
Yeah, that's absolutely right. And remember, you can spread even if you are not having symptoms. So I think that's what people need to understand, is that even though you might feel well, you need to still remember who's kind of been in what I call like your bubble, or who's in your quarantine, so to speak. So knowing the actions of those folks really helps to determine what your risk might be, and really thinking about, we're with vaccination, which we're talking about today, we're getting closer to being able to have some of these things again, but we're not quite there yet. And so all I ask is that, at a level with such high incidence, we really need to be conscientious about the choices that we're making, because right now we're at a crisis with hospitalizations. We're at record high ICU beds, hospital bed occupancies. So even though you might not be in the hospital for COVID, there's certainly going to be some difficulty getting beds for things like heart attacks, strokes, orthopedic, like if you have a car wreck and break a leg, those types of things. So,
I work, here in the hospital, and I work, even with your husband, Dr. Stewart, in an ER, and I know he's been seeing a lot of increase, and even the weekend, we had a patient that we worked together, and the bottom line is that with no beds, you're not going to be transferred out. If you're giving, antivirals such as remdesivir, you're giving, convalescent plasma, you're giving high-dose steroids, we may not be able to at this point in time, we may not be able to transfer you, because the bottom line is these hospitals really don't have anything further to offer than what we have now. Mm-hmm. So it's just so important, that we stay safe. So what would you recommend for people as far as testing? Again, so many people are asymptomatic, but I guess I still hear people say, again, I think it's just a cold. I think it's just a sinus infection. Oh, I always get, allergies, whatever. Maybe you can just go over again, like the importance of being tested and who should be tested, and how do we go about that?
Yeah, that's a great question. I think if you have any symptoms, COVID needs to be ruled out first. Yes, it might be a sinus infection or allergies, but it could also be COVID. And we see a lot of times that people kind of write that off, think it's not, and then they go to work or they're in school, and then that's when it spreads. The other time people should be tested is after you've been exposed. So around day 5 to 7 is the most common time to turn positive. We would ask that you be tested. The other thing that's really critical is that if you know that you've been exposed to someone with COVID-19, quarantine yourself. Don't go to the grocery store. Don't go to work. Please stay home. That's how we stop the spread. This is a virus. It needs a living host. And if you're that living host, we want to stop that from you. So it stops with you.
I think, some people, they're waiting for the health department to call them to guide them as to what to do. And, just the other day, you and I were on the phone, and you said, hey, it's 1 o'clock in the afternoon, and we've already had 72 positive cases. And so you don't have the manpower to be able to contact all these exposures. And so I guess people are going to take it upon themselves, if they know of a contact or an exposure, what should they do?
I think it's really important that you would minimize any non-essential activity, which means you need to stay home. If you know that you've been exposed, we ask that you don't go to work, that you don't go to church, that you stay home, you isolate and quarantine from your family to try to prevent the spread. And then that you would get tested at day 5. If that test is negative, you could be released then at day 7 with a 5 to 12% chance of becoming positive post-quarantine.
Yeah, because I think, the quarantine guidance has changed a bit. And so I'm glad that you brought that up, because I think I get that question posed a lot. I think I had exposure, come to find out, I was at this gathering and so tested positive, and what should I do?
Yeah, I think that there's 3 different options. 14 days is definitely the safest. 10 days is the next option. Those would be the 2 options if it's a household contact. And 10 days would be without testing. The third option is to test at day 5 with release at day 7. And again, there's about a 5 to 12% chance that you would turn positive post quarantine.
So, as we're still on this topic of testing, what do you say to people that say, I'm going to get a test prior to going to a wedding, a family gathering, a birthday party? I want to be able to test my way into that gathering. What are your thoughts on that?
Well, we've seen that fail time and time again this entire pandemic. And so remember, the swab in the nose is a point-in-time collection of a specimen. And so it tells me that when the swab was in your nose, you did not have COVID. And so I think that it's important if you could test and be positive, but you can't use the negative test to think that you're safe and in the clear.
Yeah, because I've heard people, say that. Well, I'm going to go ahead. We're all going to get a test, and then we're going to go ahead and we're going to meet together. And I think that maybe tell me a little bit about the whole incubation period, because I think sometimes people forget about that there is an incubation period with this virus, correct?
Yeah, right. And I describe it to people like planting a seed. So thinking about when you look at the seed packet that you get, on the back of the seed packet, it'll say, germination time is 7 to 10 days. The same thing is with COVID-19. The germination or incubation time is 2 to 14 days. So you might feel fine all the way through. Remember, 5 to 7 days is the most common time that you would become symptomatic and turn positive, but it could happen anywhere from day 2 to day 14.
So again, I'm glad you said it, because I think that some people think that just because they had a negative test on this date, then therefore next week they can get in their car, drive down to North Carolina, visit family, and everybody was safe. And we obviously know that you can't really test your way into a holiday or a gathering or something like that.
Right.
So I guess vaccines. That's what the whole shows about is vaccine. So I guess I want to ask you this, okay? I see you have your flare, okay,
Yeah.
your badge of courage. So I guess I want to ask you, like, how did you feel? So you had your first dose 3 weeks ago. You had your second dose today,
Yeah.
so you're in front of me now. How did that go?
Yeah, so first dose, I had a little bit of arm soreness, and I felt a little flushed the first night that I had the vaccine, but I never had a fever. I worked all day the next day, and the day after, and the day after, and on and on. And then today I got my first dose, and my arm, I'll be honest, is not sore. I feel fine. I don't feel any different than I did beforehand.
Now, which vaccine did you receive?
I received the Pfizer BioNTech product. So there's a 21-day between the prime dose and the boost dose.
So 21 days for that, and since our last show, now we have Moderna.
Yes.
And it is 28 days, correct?
Yeah, the Moderna product is 28 days. The other difference in those vaccines, they're both mRNA vaccine. The Pfizer product can be given to 16 and up, but the Moderna product is 18 and up.
Okay. Well, we're going to take a break, and when we come back, what we're going to talk about is we're going to talk about who should be getting the vaccine. We're going to talk about some of the myths about side effects, and we're going to talk about obviously the people that may not want to get a vaccine, and we'll kind of see that that's a very small number, and we're going to go over that. And also, I want to get my second dose of the Pfizer vaccine when we come back. You're not going to miss it. We'll be back in a second.
This is Doc Talk with Dr. Paul Conley, brought to you by Plateau Medical Center. Doc Talk with Dr. Paul Conley is a production of the Signer Foundation, which is solely responsible for the content. This is Doc Talk with Dr. Paul Conley, brought to you by Plateau Medical Center.
Welcome back to Doc Talk. I'm Dr. Paul Conley, and this is going to be COVID vaccination part 2 with our guest, Dr. Anita Stewart. So, Dr. Stewart, a couple of things, maybe you can go over a little bit of the differences, with the Pfizer vaccine, the Moderna. One thing at the break, you were talking a little bit about, we don't want to mix these up either. You want to make sure you stay with one or the other. Maybe you can kind of go over a little bit about the differences and maybe the similarities.
Yeah, so they're both mRNA vaccines, and they both have similar effectiveness or efficacy. It's about 95% at reducing clinical and severe disease, which is excellent for a vaccine. We're very excited about that. Some of the differences are that they're stored in different capacities. The Pfizer vaccine is stored at ultra-low cold temperatures. It lasts about 5 days outside of those temperatures in refrigeration. The Moderna vaccine is a frozen vaccine that can last in the freezer for 6 months. And in refrigeration, it can last about 30 days. So there's a pretty good window there. Once you puncture the vial, the Moderna vials are 10 doses, the Pfizer vials are 5. They both last about 6 hours from puncture.
So, we've heard a lot of different things about messenger RNA. Maybe you can just talk just a little bit about that, because I still have people concerned. Their concern is, I don't want to get this vaccine because I'm afraid, A, I could get COVID from the vaccine, or B, I could transmit that COVID virus to someone at home or a loved one. So maybe you can tell me a little bit about messenger RNA, and is that even possible to get COVID from the vaccine?
Yeah, so it's not possible to get COVID from the COVID-19 vaccine. There is no live virus in this messenger RNA. Messenger RNA simply is a protein that makes a copy. It gets into the cell, makes a copy, and then that brings that into your immune system to create a response to help you to be able to fight COVID-19 in the future. So
who right now are we trying to make sure we get vaccinated? We're in the process of this rollout. I know there's been different categorizations. So who are we really right now trying to target and make sure we get immunized?
Yeah, so we have a couple different targets. So one is, and these are all targets that we're trying to hit at the same time. So our first goals were healthcare workers, to try to keep our healthcare force ready to go, especially with the increases in hospitalizations and ICU needs. The second is long-term care facilities and residents, so residents and staff in those facilities. The third would be the most vulnerable. So we know that as we age, the increased risk of morbidity and mortality from COVID-19 increases. So starting with the CDC recommends 75 and up. Each state has kind of its own jurisdiction of how they enroll that. West Virginia has chose to start with 80 and above. And I think that that's working very well right now.
So who right now would you say we can't vaccinate right now? I've had some people who I've had coronavirus, so does that mean I even need to get a vaccine if I've already had COVID? Or I've had COVID and I want a vaccine, and when should I get that? So tell me, can you get the vaccine when you've had COVID, or if you've had COVID, should you get a vaccine?
Yeah, I think those are great questions, and I think it's important that, first of all, I think it's important to respect the patient-physician relationship. So that person should talk to their physician, which they're talking to you or to me or others in our community, to get that guidance. They know you best as your provider. But certainly we know that if you've had COVID before and you've had clinically significant disease, that you likely have a 90-day durable immunity, which means like a natural immunity to help keep you safe and protected. The CDC does encourage, if you're offered the vaccine, that would not keep you from getting the vaccine. So if you've had COVID-19 and you've recovered from it, you've done your 10 days, your illness symptoms have resolved, you don't have a fever anymore, you've been released by your healthcare provider or the health department, then you would be a candidate for the vaccine. So you could receive the vaccine at that point in time if you so chose.
What about folks, and I've had people ask me a lot of questions about people that have allergies to certain foods. They have shellfish allergy, bee sting allergy. Some people have even said, hey, I'm that individual that I just never do well with medications. Should I receive this vaccine? So tell me about those folks.
Yeah, so those patients would still be eligible for the vaccine. We would encourage them. What we're really watching for is injectable medications, IV medications, and past vaccine anaphylactic events. If you've had those events, that doesn't mean that you cannot have the vaccine. It means that we need to monitor you closer and for longer. So we would monitor you for at least 30 minutes after your dose, see how you're doing. We always have medications to reverse anaphylaxis on hand, so the EpiPen, Benadryl, Solumedrol, things like that to help keep people safe. If you have a food allergy or bee sting allergy, those types of things, we would monitor you for 15 minutes. It does not increase your risk of anaphylaxis with the mRNA products.
What about the person who has had COVID and they got sick and they received monoclonal antibodies, which I think, we're encouraging people to consider early on. Maybe you can talk a little bit about monoclonal antibodies. When should one, really look, to get that? And then again, if they've received monoclonal antibodies, when should they get the vaccine?
Yeah, that's a great question. So it's really important if you're high risk, so if you're over 55 and you have at least 1 to 2 chronic medical diseases like diabetes, COPD, cancer, immunocompromised for any reason, morbid obesity, we would encourage you to consider getting one of the monoclonals. There's 2 products, the Lilly product and the Regeneron product. We have those available here locally. It's an infusion over an hour, and it actually helps reduce morbidity related to disease. We would encourage folks to get that as soon as possible. So as soon as you have the diagnosis, we know the better it works if you get it in sooner. In regards to when can you get your vaccination after having monoclonal antibodies or convalescent plasma, again, that's a discussion with your healthcare provider. The ACIP, which is the group that does guidance for immunization practices, they've recommended waiting 90 days before that, but it's a risk-benefit type of discussion. If you have someone that's getting exposed over and over and over again, say they work in the ER, then the benefit of getting the vaccine at that point would outweigh the risk. So I think it's a discussion that you have with your local healthcare provider, potentially infectious disease or public health, to come up with a decision that works best for you.
Well, I'm glad that you talked about the monoclonals, because I think it's important that people understand that if you're 55 or older and have some of these comorbidities and you have a positive COVID test, you would be someone that you may want to consider monoclonals, because I think the problem is we see here in the hospital is people wait too late, they stay at home, they don't want to come to the hospital, and then when they get so severely sick, then they come to our emergency room, and when they do, there's not much we can offer them at that time, because once you get hospitalized, that's when we talk about the serious illness, hospitalization, and then those are the folks that don't do very well.
Right, and those are patients that are not candidates for monoclonal antibodies. Once you've been hospitalized, you're beyond that point.
So one thing, back to the vaccine, because we're getting ready to hit a break, and I want to make sure you get my vaccine before the end of the show. Where can people go to get the vaccine? So we got people wanting to get it. Where do they go?
Yeah, so for 80 plus, those are being handled by public health, so local health. We're having events, scheduling people in to get those doses in arms. As we finish up with 80 plus in our community, we'll be going to 70 plus. So the governor is doing it by age brackets. Other places that have it are federally qualified health centers. They're going to be doing the Moderna for 80 plus. And then pharmacies in our community also have the vaccine. They are going to be doing other sectors like healthcare workers, local government, and other groups that are in the phases outlined by the governor.
So do they call the health department, or how do they know? Do they schedule an appointment? How does that work?
Yeah, so if they are part of the public, like part of the sectors in the phases that the governor has outlined, so local government, healthcare worker, things like that, they will be getting an email that tells them that they're eligible for their vaccine, and they can go get their vaccine at a local pharmacy. If they're 80 and above, they can call either their healthcare providers if it's at an FQHC, which would be like New River Health, Access Health, Raynell Medical Center, and they can get the vaccine there. Or they can call the health department. We have a list of patients that are 80 and above, and as we go through it, then we call more as far as to schedule them. I think that hospitals and other healthcare providers in this community, so Plateau Medical Center, Montgomery General, we're going to be getting doses of vaccine to get to the community. So that should be coming in the next few weeks, I imagine.
That's good news. So we're coming up on a break. We're going to take a quick commercial break. When we come back, Dr. Stewart's going to give me my second dose of my Pfizer vaccine. You're not going to miss this, and we'll be right back.
Doc Talk with Dr. Paul Conley. We'll be back in a moment. Doc Talk with Dr. Paul Conley is a production of the Signer Foundation, which is solely responsible for the content. This is Doc Talk with Dr. Paul Conley, brought to you by Plateau Medical Center.
Welcome back to Doc Talk. I'm Dr. Paul Conley, and we're here tonight talking about vaccination, part 2. I have Dr. Anita Stewart here, our public health officer, and I'm about ready to receive my second dose of the corona vaccine.
Yeah, so you received the first dose was a Pfizer product, so today it's really important that we give you the second dose of the Pfizer product. So are you ready for that?
And it's important, I think, that people understand that when you get the first dose, you really got to make sure you come back for the second dose, right?
That's right, absolutely. That's how you get the most protection.
Yeah, I didn't have any side effects or anything the first go around. You gave me my shot the last time, and I didn't even feel it. And I did not feel it, and the next day I had a touch, a very small soreness on my arm, but that was it. So,
okay, great.
Yeah, so
well, I hope we have the same this time. I'm going to pull up your sleeve here, and you've already done your pre-vaccination questionnaire.
Yes, I have.
So we're ready. All right. Picture stick. All right. You're good. Feel all right?
Easy as pie. How about that? Well, I tell you what, Dr. Stewart, I really, really appreciate all the information you've given us on the show tonight. You've went over a lot of information, and I just want to tell you, I feel so much more protected to take care of folks in the community and you as well. Now we're both been vaccinated, and I think that's so important that people watching the broadcast understand the importance of immunization and vaccination.
Yeah, we're one step closer, and this is another tool in our toolbox to help keep us protected and safe from COVID vaccine or COVID-19.
Well, I really appreciate you coming on the show, and again, you're always welcome to come on and give us updates, and I'm sure we're going to be getting more and more updates as we go on. I appreciate your time. I'm Dr. Paul Conley. You've been watching Doc Talk, and until next time, have a good night.
Doc Talk with Dr. Paul Conley is a production of the Signer Foundation, which is solely responsible for the content.